Hello, my friend, and welcome to another episode of Nicole's Speech and Language Consultations. I'm Nicole Charles, a speech language pathologist, here to discuss the many ways therapy can impact speech and language development for children with Down syndrome. Children with Down syndrome frequently experience challenges to speech and language development. At minimum, speech is usually delayed, though many can be taught effective sign language to help with communication during the first few years and beyond. Now, of course, there is a great deal of differences among children with Down syndrome. However, their speech and language development tends to follow a similar pattern. Here are some challenges children with Down syndrome may face in regard to speech and language. Hearing loss in one or both ears of varying degrees can significantly impact speech and language development. Oral motor function is one's physical ability to produce speech. Certain facial structures, nerve, and muscle conditions are impacted. For example, they tend to have smaller oral cavities than what is typical and have larger than average tongues. Therapy can address a child's ability to be understood, including speed of movement when speaking and range of motion. Learning delays and disabilities in children with DS is often presented as trouble with short-term memory, which leads to difficulty memorizing certain sounds. The speech pathologist will help improve their reduced understanding of language, which can also later impact reading skills. The speech language pathologist might target social functioning as well as your child's motivation to communicate if they also exhibit traits of autism. It's best to start at an early age for intervention for even just one of the areas of difficulty I mentioned earlier. The goal of therapy is not to magically erase these issues completely, but to help your child reach their own maximum potential. If you would like to know what are the questions every parent needs to know and ask your child's speech therapist before, during, and after an evaluation, visit my website listed in my bio. This concludes today's episode, and I wish everyone to have a happy Thanksgiving.